Ladies, let us engage in a frank and open conversation. A great many of us do not fully realize that, just like your heart, your brain, or your bones, your vagina also undergoes a process of aging. If we choose to ignore this sensitive and vital part of our anatomy, we do not just risk the gradual loss of its function, we risk the erosion of our confidence, our daily comfort, and the intimate connection we share with those we love. This is an aspect of our health that is profoundly and inextricably linked to our fundamental sense of self, and providing it with dedicated care is every bit as important as managing our cholesterol levels or remaining physically active. My name is Dr. Lily Stones, and I am a physician who specializes in the holistic wellness of women. For more than 3 decades, I have had the profound privilege of assisting women in navigating the intricate and often unspoken changes that come with the passage of time, helping them to preserve not only their sexual health, but also their vitality, their confidence, and their very identity as women. Now, what if I were to tell you that one of the most significant causes of vaginal discomfort and dissatisfaction in women over the age of 60 has very little to do with your chronological age? And what if the most effective solution was not to be found in a prescription tube, but rather in a series of simple, consistent daily habits that possess the power to change everything? In our discussion today, I am going to share with you 5 essential, science-backed methods for caring for your vagina and vulva, each one specifically tailored for the unique physiological needs of women over 60. These are not superficial gimmicks or temporary quick fixes. They are real, tangible, and practical strategies that can diligently protect your health and dramatically enhance your quality of life. And I urge you to stay with me until the very end, because I am going to share a special bonus tip that most doctors never mention, but which could be instrumental in helping to prevent one of the most common and persistently irritating conditions that we see in older women. Before we delve into the core of this important topic, if you find this advice to be helpful and resonant, please take a brief moment to subscribe to this channel and activate the notifications. By doing so, you will ensure that you never miss out on practical, age-specific health guidance that is designed exclusively for you. Your journey toward better health is of paramount importance, and your feedback helps me to make this information as useful and supportive as possible. Let us begin with the first essential component of caring for your body as it gracefully evolves the principle of keeping it active. 1. Stay sexually active, even without intercourse. When I engage in conversations with women in their 60s, 70s, and the decades that follow, one of the most common refrains I hear is, "Well, I suppose my sex life is now over." A vast number of women have quietly and resignedly accepted the idea that their sexual function is destined to naturally fade away, and that there is absolutely nothing that can be done to alter this course. Allow me to be unequivocally clear on this matter. Not only is that particular belief factually untrue, but it can also tragically become a self-fulfilling prophecy. Your vagina, much like your muscles or your mind, depends fundamentally on regular and consistent use to maintain its health and vitality. When it remains inactive for extended periods, the intricate network of blood vessels that nourishes it begins to function less efficiently, and blood flow diminishes. As a consequence, the delicate tissues can become thin, dry, and significantly less elastic. This clinical condition is known as vaginal atrophy. It is far more common than most women are led to believe, affecting a significant portion of the post-menopausal population. But the wonderfully encouraging news is that it is almost entirely preventable. Sexual activity, and this absolutely includes masturbation, is not solely for the purpose of pleasure. It is a critical form of physiological maintenance. By regularly encouraging and stimulating blood flow to the pelvic area, you are actively delivering a vital supply of oxygen and essential nutrients. This nourishment is what maintains the health of the tissue, its inherent elasticity, and its capacity for natural lubrication. Think of it in the same way you would think of stretching a muscle to prevent it from becoming stiff, tight, and prone to injury. And if traditional intercourse or solo stimulation is not currently possible or comfortable for you, please know that that is perfectly okay. There are numerous other highly effective methods available, such as the use of medically approved vaginal moisturizers, the gentle and gradual use of vaginal dilators, or even the consistent performance of pelvic floor exercises. Each of these practices serves to support healthy circulation and maintain the integrity of the tissue. The single most important principle is not to allow that part of your body to become idle. Beyond the purely physical aspects, there is an equally important emotional component at play here: the concept of dignity. For a great many women, our sexual vitality is deeply and intricately intertwined with how we perceive ourselves, with our identity, and with our self-worth. When that vitality begins to fade, our confidence often follows suit. By choosing to stay sexually active, in whatever form or fashion works for you, you are reclaiming not just a physical function, but also a profound sense of pride and a core part of your identity. This is not about a futile attempt to be the woman you were at 25. It is about staying deeply and authentically connected to the wise, experienced, and immensely valuable woman you are right now. I have personally witnessed women in their 70s and 80s regain significant control over their sexual health and well-being simply by embracing this foundational first step. More often than not, once they do, other aspects of their lives begin to improve as well. It creates a powerful and positive ripple effect of confidence, renewed intimacy, and motivation that permeates their entire existence. 2. Keep it clean the right way. Now that we have addressed the fundamental importance of keeping it active, let us move on to another crucial aspect of maintaining your sexual and vaginal health: the practice of keeping it clean in the correct manner. This might sound like elementary common sense, but proper hygiene for the vulva and vagina is frequently one of the most overlooked facets of self-care as we age. In my extensive clinical practice, I have seen countless women present with painful infections, chronic and debilitating irritation, or persistent urinary tract issues simply because no one ever took the time to teach them how to properly care for their bodies as they underwent these natural changes. This is not a matter of being dirty. It is about recognizing that your body at 60 or 70 is not physiologically the same as it was at 30. As we age, our skin naturally becomes thinner and more sensitive. The delicate pH balance of our vagina shifts, becoming less acidic and therefore less protective. Furthermore, our bodies gradually lose some of their ability to efficiently fight off bacteria and heal from irritation as they once did. The very hygiene routine that worked perfectly well for you in your younger years may no longer be sufficient or even appropriate for many women, especially after menopause. Maintaining a healthy and balanced vaginal microbiome becomes even more critically important. The use of harsh soaps, the practice of douching, and the application of scented products can strip away the beneficial bacteria that reside in the vaginal area, leaving you vulnerable and exposed to irritation, bacterial vaginosis, or recurrent yeast infections. You might even discover that you have become sensitive to products that you have used without issue for many years. But here is the excellent news: the solution is remarkably simple. You should wash the external vulva area with just warm water on a daily basis, or if necessary, use a mild, unscented, pH-balanced cleanser. It is imperative that you never douche. The vagina is a self-cleaning organ with a remarkable ability to maintain its own ecosystem. Most importantly, after cleansing, you must make sure to gently pat the area completely dry with a soft, clean towel. Lingering moisture, especially within the delicate skin folds, can create an ideal environment that encourages the growth of both bacteria and fungi, which can lead to infections or an unpleasant odor. This simple yet profound habit of keeping your intimate areas scrupulously clean and dry can save you from a great deal of chronic discomfort and can be instrumental in preventing infections. Many of my patients are genuinely surprised by the emotional boost that accompanies this simple act of dedicated care. When you begin to treat this part of your body with the same level of respect and attention that you give your heart or your teeth, you start to feel cleaner, more confident, and more in control. It is a fundamental act of honoring your body and providing it with the gentle and appropriate care that it so rightly deserves. 3. Avoid intercourse without adequate lubrication. This next piece of advice might surprise you, but it is one that I have seen cause real and lasting harm to women who are not aware of the potential risks. A great many women unknowingly injure themselves during moments of intimacy simply because they do not realize the critical importance of being fully and adequately lubricated before engaging in intercourse. While it might feel like a minor detail in the moment, not being properly lubricated can, over time, lead to long-term damage with life-altering consequences. Following menopause, the natural decline in estrogen levels causes the vaginal walls to become thinner, more delicate, and significantly less able to produce their own natural lubrication. Without proper arousal and the supplemental use of a good lubricant, the friction generated from intercourse can cause tiny, microscopic tears and abrasions inside the vagina. You might not feel these minute injuries immediately, but over time, they can lead to persistent pain, a burning sensation, and an increased risk of developing urinary tract infections, UTIs. This can inadvertently create a painful and difficult cycle. You begin to associate intimacy with pain, which then causes you to tense up in anticipation of that pain, thereby making the problem even worse. This condition, known clinically as dyspareunia, is incredibly common among post-menopausal women, but it often goes unspoken due to embarrassment or a lack of knowledge. I have sat with numerous women who were too ashamed to mention the pain they were experiencing until it reached a point where they began avoiding intimacy altogether, leading to strain in their relationships and a loss of their own sense of self. The truth is, there are simple and effective solutions to prevent this from happening. I always advise my patients to slow down and to take the necessary time to properly prepare their bodies before engaging in intimacy. Waiting until you are fully and completely aroused and making generous use of a high-quality, long-lasting lubricant can protect you from long-term pain and help to ensure that sex remains a source of pleasure and connection, not a source of discomfort and dread. Take your time with foreplay. Communicate openly and honestly with your partner about what feels good and what does not, and use plenty of lubricant. This is not just about momentary comfort. It is about protecting your long-term health and making sure that intimacy remains an enjoyable and fulfilling part of your life, not something to be feared or avoided. By treating your body with the respect and patience it deserves, you will preserve your sexual health and keep intimacy as a vital and nourishing part of your life. 4. Reconnect with your desire. Maximize real intimacy. Now, let us talk about something that often gets overlooked as we age: desire. We live in a culture that tends to propagate the narrative that desire naturally fades away after a certain age, becoming a relic of our youth. For many older women, especially those who may be single, widowed, or are feeling disconnected from their own bodies, it can genuinely feel as though that particular chapter of life is permanently closed. But after working with thousands of women over my career, I can tell you with absolute certainty that what often fades is not desire itself, but rather our connection to it. Here is the fundamental truth. Our patterns of arousal change and evolve over time. The spontaneous lightning bolt desire that you may have felt in your 20s often matures into a more responsive form of desire. This means that, for many women, desire now arises in response to experiencing pleasure and connection, rather than appearing before it. If you continue to wait until you feel a spontaneous wave of desire before you engage in any form of intimacy, you might find yourself waiting forever. I have worked with a great many women in their 60s and 70s who describe feeling confused and deeply frustrated by this shift. They still love their partners and genuinely want to experience intimacy, but their bodies do not seem to be getting the memo. They start to believe that something is fundamentally wrong with them. But in the vast majority of cases, the issue is not a broken body, it is the need to rediscover a new and more patient pathway to pleasure. A lifetime spent focusing on the pleasure of others, or even just the accumulated pressures of life, can lead to a profound disconnect from our own sensual selves. I am not here to pass judgment, but to wholeheartedly encourage exploration and a renewed sense of awareness. I advise my patients to consciously and intentionally reconnect with their own bodies through the avenues of touch, memory, and imagination. Spend more dedicated time with self, pleasure, and extended foreplay. Talk openly and vulnerably with your partner about what feels good now, which may be different from what felt good in the past. And most importantly, allow yourself to experience pleasure without the burdensome pressure of achieving a specific outcome or a particular goal. Your desire has not disappeared. It has simply matured and transformed. This is not about giving up on intimacy. It is about reclaiming it in a healthier, more authentic, and more meaningful way. The more you reconnect with yourself and your own unique desires, the more fulfilling and enriching your intimacy becomes, bringing you closer not only to yourself but also to your partner. 5. Prioritize your lifestyle over medications. Now that we have covered the importance of staying active, cleaning the right way, and prioritizing lubrication, let us move on to the next essential step in taking care of your sexual health, prioritizing your lifestyle over a reliance on medications. If there is one single thing I have learned after decades of working with women over 60, it is this: the way you live your life has a far greater and more profound impact on your sexual health than any prescription ever will. Many of my patients come into my office hoping for a magic solution, such as vaginal estrogen or other pharmacological treatments, to fix what they feel they have lost. And while these treatments can be incredibly helpful and, for some, medically necessary, the reality is that no medication on this earth can undo the cumulative damage caused by an unhealthy lifestyle. The truth is, your daily habits are the absolute foundation of everything. They determine your blood flow, your hormone levels, your mental clarity, and yes, your ability to feel aroused and comfortable in your own skin. Healthy arousal is at its core all about good blood flow. And your blood flow depends entirely and unequivocally on the health of your heart and your entire vascular system. When you smoke, drink alcohol excessively, carry extra weight, or consume a poor diet, you are actively and progressively damaging the delicate blood vessels throughout your body, and this includes the intricate network of vessels that supply the clitoris and vagina. In fact, sexual dysfunction is often one of the very first and earliest signs of underlying heart disease. It is your body's way of sending you a crucial signal that something more serious may require your immediate attention. But here is the wonderfully empowering news: every single healthy choice you make has a direct and positive impact. When you quit smoking, your circulation improves almost immediately. Reducing your alcohol intake helps to balance your hormones and significantly improves the quality of your sleep. When you start walking for just 30 minutes a day, or begin to add healthy foods like leafy greens, vibrant berries, and omega-3 rich fish to your diet, you are not only adding years to your life, you are adding vibrant life to your years. Making small, consistent, and sustainable changes in your daily habits can have a profound and lasting effect on your overall health and your sexual well-being. Your energy will return. Your confidence will grow. Your body will respond. There is nothing more rewarding for me as a physician than watching a woman realize that her body is not broken. It simply needed the right kind of care and nourishment. So, before you rely solely on prescriptions or quick fixes, try reaching for your walking shoes. Choose water over a second cocktail. Prioritize a good and restorative night's sleep. Your body is listening to your choices, and every single healthy decision you make truly counts. Bonus tip and conclusion: the power of small habits. As we conclude our conversation on how to care for your vagina and vulva after 60, let us talk about the final piece of the puzzle: the small habits that make a big difference. Often, it is the most minor changes in our daily routine that can have the most profound and lasting impact on our health and comfort. One of the most overlooked, yet incredibly simple habits is the practice of sleeping without underwear. Now, you might think this sounds trivial, but please hear me out. Sleeping without underwear can make a surprising and significant difference in maintaining your vaginal health. Throughout the night, your body enters into a state of repair and regulation. For women, maintaining a healthy environment in the vulva area is absolutely essential to prevent irritation and infection. When you wear tight or synthetic underwear to bed, you effectively trap heat and moisture against your skin, creating the perfect warm, damp breeding ground for yeast and unhealthy bacteria. This can lead to chronic yeast infections, bacterial vaginosis, or general irritation, particularly as your skin becomes thinner and more sensitive with age. By simply choosing to sleep without underwear, or by opting for loose, fitting, breathable cotton pajamas, you give your body the freedom to breathe and to naturally maintain a healthy pH balance in the vaginal area. It is a tiny adjustment, but it can make a world of difference in preventing discomfort and maintaining your long-term vaginal health. I know that talking about sexual health and intimate care can feel awkward, especially as we get older. But the truth is, our relationship with our bodies does not end at a certain age, it simply evolves. The way we choose to care for ourselves now matters more than ever. Everything we have discussed today, keeping active, practicing good hygiene, being prepared for intimacy, reconnecting with your desires, and living a healthy lifestyle, are not just items on a checklist. These are small, daily acts of self-respect that reinforce your dignity, your vitality, and your connection to the woman you are today. It has been my life's privilege to help women rediscover this confidence, not by chasing a younger version of themselves, but by choosing to care for the body they have now. You are not alone if you have been struggling in silence or feeling unsure of where to start. The best news is that it is never too late to begin. Your health does not define your worth, but it absolutely reflects the attention you give it. True vitality in our later years comes not from ignoring change, but from meeting it with grace, knowledge, and a steadfast commitment to self-respect. Your health is your story. Make it a great one. Thank you for being here and for investing in yourself. If this message resonated with you, please leave a comment below. And if you know a friend, a sister, or a mother who could benefit from this conversation, please share it with them. Do not forget to subscribe for more honest, practical discussions about women's health. Taking care of yourself is a sign of strength, and you are never too old to start.